Women are not the only victims of rape. It happened to me more than once. Men with disabilities experience sexual violence twice as often as men without disabilities.
Because of these alarming rates, you're likely to see male patients or patients who are not gender conforming who have experienced sexual assault. Talk about sexual violence can help make appointments both productive and efficient for you and your patients. Convey to your patients that you care, even if you're unsure about what happened. Your patients may not be able to communicate verbally, but they can still respond to your questions. Your patients have the right to talk with you privately. To speak with them one-on-one, ask their caregiver or family member to leave the examination room. Ask direct, open-ended questions using everyday words. Some patients may need time to respond because they may be embarrassed or have limited language ability. Keep communication charts on hand with illustrations of body parts, words, and emotional expressions. Listen carefully, look for the physical signs of abuse, and observe body language and facial expressions, and emphasize that sexual violence is never the victim's fault. What is disclosed by patients with disabilities must be regarded seriously, even if you are unsure about the disclosure. Patients' diagnoses should never be a reason to minimize or ignore what they tell you about sexual assault. Remind your patients that they also have the right to report abuse to law enforcement. Encourage them to confide in a trusted person to learn more about their options. Know your reporting requirements. Mandated reporter training is available in each state. Direct your patients to local agencies that provide help to victims. Include contact information for crime victim resources. If you have difficulty talking about sexual violence, seek training. Use the teach-back method to review information with your patients. Ask them to describe what they heard and emphasize that sexual violence is never the victim's fault.
Rape and sexual assault happens to us, too.
Remember, listen, report, and refer.